Caring for someone with dementia is one of the toughest journeys, but you don't have to do it alone. I'm Allison Schreier, and my experience caring for my husband inspired me to create Zinnia, a therapeutic streaming service designed to support people living with dementia and reduce caregiver stress. Our research-backed videos are engaging, easy to follow, and they help ease the daily challenges like agitation and anxiety so that you can focus on connection and joy. Available by subscription on mobile and TV apps, Zinnia makes every day a little bit easier. Go to zinniatv.com and sign up for a free trial today. Use the code RESOURCE for 15% off an annual Zinnia subscription.
Welcome to Medicare Moments, America's favorite Medicare podcast with your host, Toni King. Hi, Toni.
How are you doing, Jim? What's going on?
Well, we're getting ready to talk about Medicare and stress. Do those two words work together? I don't know.
They explode together. That's all I hear. I'm so stressful. I'm so confused. I don't know what to do. Could you help me? I don't want to make a mistake. And the big word everybody worries about is penalty.
Penalty, right? You
don't
want
penalty
that.
Is always there.
So, Toni, the title of this one is Changing to a Medicare Advantage Plan is Stressful. And this question comes to you from Atlanta, Georgia, saying, hello, Toni. My question is, if I change to a Medicare Advantage plan in the fall and find out it's not working for me, what are my chances of returning to a Medicare and a supplement? I have a Medicare supplement plan F that is over $300 monthly, and I'm looking for something more reasonable. I'm a 78-year-old female in fairly good health. I've spent time searching on Medicare.gov for what different Medicare Advantage plans offer, but cannot find out what doctors and hospitals are in the networks. I'm just as confused right now as when I started out, and I need your guidance, Toni. Looking forward to what you have to say. Thanks, Sally from Atlanta, Georgia. So, Toni, what do you say to Sally?
Well, all I can say is Sally has a big problem because she's looking right now for a Medicare Advantage plan for the fall. And guess what? There's going to be all new Medicare Advantage plans starting October 1st. So she can research all she wants to, but the research is going to be different October 1st. What I would do if I was Sally is I would try to see if I could qualify for another Medicare supplement. She's going to want to go with a Plan G versus the Plan F and see if she can get something that's less expensive, because there's nothing any better than original Medicare with a Medicare supplement. You don't have to worry about your hospitals, your doctors, or anything, but she could possibly save a lot of money. If she has health issues and she can't make a change, then look in October and see which plans are going to be the best. But she's going to want to talk to her doctor and see what plan he's in, what plan he thinks is going to be a good one for her.
So is it fair to say that October 1st is the time to start, is the time to look, because then you'll know what's available to you?
That's right. That's when she needs to look for the Medicare Advantage plan.
Every year it's October 1st.
Every year it's October 1st. But right now she needs to look for a Medicare supplement, July, August, September, see if she qualifies. She may be too heavy. She may be taking way too many blood pressure meds. She may be having cancer issues. Maybe an insulin-dependent diabetic. Some people think they have no health issues, but they're the insulin-dependent diabetic with cholesterol problems. There's a lot to it. You've got to take your time to do this.
And so then you have to answer those medical questions if you're signing up for a supplement. Is that correct, Toni?
Correct. And if you can't get accepted, then we look for something else for you.
Well, I just went through that with you, and you were very successful with me. So thanks for all of your planning, and it worked out really well. And
it turned out better than we thought.
Yes. So we will be back right after this short message. Don't go away.
Caring for someone with dementia is one of the toughest journeys, but you don't have to do it alone. I'm Allison Schreier, and my experience caring for my husband inspired me to create Zinnia, a therapeutic streaming service designed to support people living with dementia and reduce caregiver stress. Zinnia offers research-backed videos intentionally created for people with dementia, engaging, calming, and easy to follow. Whether you need to ease agitation, create moments of joy, or make daily routines smoother, Zinnia is here to help. Family and professional caregivers use our content to turn challenges into opportunities for connection. Accessible by subscription on mobile devices and connected TVs, Zinnia is simple to use whenever you need it. Because when caregiving feels easier, life feels better. Go to zinniatv.com and sign up for a free trial today. Use the code RESOURCE for 15% off an annual Zinnia subscription.
Welcome back to Medicare Moments. Changing to a Medicare Advantage plan is stressful. And Toni says stress is lockstep sometimes with when you're applying for Medicare because people just don't know where to go or what to do. And that's why we do this podcast. And that's why there is a website, tonisays.com, TONISAYS.com, because we want you to be prepared. Look at Toni's webinars, buy Toni's books, and let us know how we can help you by asking Toni questions. So, Toni, what are the differences between Medicare Supplement Plan G and Plan N right now?
Well, when someone's looking for a Medicare supplement, the top of the line plan is Plan F, but Plan F is slowly but surely going away. Plan G is taking its place. And Plan G, you have to pay your Part B deductible, which is for this year is $240. So my out-of-pocket when I start a new year is my Part B deductible. My out-of-pocket's $240. I can live with that. My premium is very affordable. Yours is $240, and we just knocked a lot off your premium. But Plan N has more out-of-pocket. It's got lower premiums, and you have to pay a copay when you go to the doctor. They tried to get that as close as they could to a Medicare Advantage plan because you now have a copay when you go to the doctor or a copay when you go to the emergency room, but it is still a Medicare supplement and you can go to every hospital and doctor nationwide. So take your time, don't just, somebody calls you on the phone, just don't take it off the phone. Look at it. Have your kids there to make sure, or have a friend or somebody there to make sure that what you're doing is the right thing.
True. It's always good to have someone there, an extra pair of eyes, an extra set of ears, so they can pick up on things that you might miss, and it makes all the sense in the world. Sally did ask you about specific doctors or hospitals accepting Medicare Advantage plans. And Toni, this is something that you say a lot. Not every hospital, not every doctor accepts every Medicare Advantage plan. Is that correct?
Correct. You want to talk to your doctor and you want to talk to the hospital to find out which plan meets your needs, not meets their needs, meets your needs.
And you also say that it's important to ask if they currently accept is important because as the year goes on, sometimes doctors or hospitals will change, correct?
And sometimes insurance companies will drop certain hospitals and doctors. Or, the doctor can change in the middle of the year and not be in that network anymore. So things can change.
And Toni tries to make this easy for you because in Chapter 4 of her Medicare Survival Guide Advanced Edition, she explains the different types of Medicare Advantage plans and what to expect when enrolling for the first time or during the annual enrollment periods. Toni would like you to pick up a copy of that if you have questions at tonisays.com and get it out to you, and you'll be prepared. You won't be blindsided. You'll know going in what to expect. Is that fair to say, Toni?
That's exactly what you're supposed to say. You've got that down pat, Jim. I trained you well.
You certainly did. Folks, this is Medicare Moments. Toni King is your host, laughing in the background.
I know people don't know how stressful it is. I mean, one wrong move and it affects you for the rest of the year.
You don't want that. You want to get the very best medical care for your medical needs right now that no one can project all of those needs. But Toni, when you meet with her, you talk to her, you consult with her, she'll probably give you, the very best overview based on what you tell her your situation is, and she'll get you through it. You can call Toni on her hotline. Her Medicare hotline is 832-519-8664. America's Medicare hotline, 832-519-8664. Email Toni, info@tonisays.com. That's TONISAYS.com. Just like the website is tonisays.com. You can listen to Medicare Moments there. You can buy Toni's books there. You can sign up for her webinars there, and you can talk to Toni there by sending her a question. So
That's right. And we can be friends.
And you can be friends with Toni there. Yes. So thanks for listening to Medicare Moments with Toni King. Toni?
Okay. Well, I will see you later, Jim, and you go have a good day. And remember, we got to say, God bless America, because America is here and it's here for you, right?
Right.
Caring for someone with dementia is one of the toughest journeys, but you don't have to do it alone. I'm Allison Schreier, and my experience caring for my husband inspired me to create Zinnia, a therapeutic streaming service designed to support people living with dementia and reduce caregiver stress. Zinnia offers research-backed videos intentionally created for people with dementia, engaging, calming, and easy to follow. Whether you need to ease agitation, create moments of joy, or make daily routines smoother, Zinnia is here to help. Family and professional caregivers use our content to turn challenges into opportunities for connection. Accessible by subscription on mobile devices and connected TVs, Zinnia is simple to use whenever you need it. Because when caregiving feels easier, life feels better. Go to zinniatv.com and sign up for a free trial today. Use the code RESOURCE for 15% off an annual Zinnia subscription.